lean forward, learn, JFO, just find out. We can bring up our next key resource and sponsor that makes one of my newest favorite things out there: your mind, your words, your hand skills, how to improve yourself as a dental professional. So, one of the things to protect your dentist in core is compliance. We have Ken Frucci here, a key resource and sponsor, who's going to share with us what do you do, Ken, to help protect us, protect our safety, protect our offices, keep us compliant. Tell us about that.
Well, we have a national program that we've started. We've always been providing compliance training. We're actually a nationally accredited Academy of Dental Dentistry provider, so we can go anywhere. We provide CE credits for all of our OSHA compliance, CPR, medical emergencies, all of that. But recently, we put together a new OSHA safety COVID-19 exposure management program. In the past 3 months, we've actually had 3 clients call us. 2 out of the 3 did not know what to do when they had an employee who was exposed to COVID. And what we're learning is all the pre-screening that we're doing on our patients is certainly top notch to prevent patients from coming in. But what are we doing for staff who may come to work, who become sick because they may have come in contact with the virus outside of?
And also, Ken, I want this is such an important topic. So if you're listening, Ken Frucci, key resource sponsor, can help you if you're dealing with a challenge with COVID in your dental practice, which is going to be one that we're all going to deal with as dental professionals, people, and patients. And this is if you have a team member or a patient dealing with it. It's very confusing, Ken. Also, I have to say, we've been in contact since this started. The rules change and guidelines change, so it's not easy to keep up with that. So you basically have helped offices who've had a COVID scenario in their office. They might have been wearing masks, they're protected, but they still don't know what to do. Tell us more about that. Like, let's say someone has this happen. How can they reach out to you, and what are some of the things you help them with?
We actually will put them under our wing on our program. We assist them with all of the reporting to all the agencies, including the town health department where they are. We make sure they're following the health department guidelines. The ADA, the CDC actually has their guidelines that actually have to do with, okay, a lot of offices are calling and saying, well, do I have to close my practice because they had an employee who had COVID? And that's not true. No. Yeah. However, other documentation, other PPE, other training. I actually was in a client today who did not have any masks whatsoever. Jeez. And I said, that is a major issue for you. You've got to get the masks and you have to train your people on those.
Right.
And, we know that even patients can come in asymptomatic with COVID. They may pass the pre-screening. Their temperature is fine. They're asymptomatic. We just don't know. There's so much about this that we don't know. But where we feel we can really help the dentist is to take that pressure and that worry off of them, because on their list of things to do, as you know, as a busy dentist, you got a million things to do. Maybe your office manager is going to be able to handle this, but we have some clients that have as much as 20 and 30 staff, and the office manager's schedule is already overextended. For sure. You need someone full time to handle this for you.
And I just said I'm struck while I'm wearing my jumpsuit here. You don't know this, not just a cool hoodie. Said, Who Are You Gonna Call was a popular 80s movie. So basically, Ken, who are you gonna call when this is most definitely going to be something you're gonna deal with the next 6 months? So I like stories. So as we wrap up, someone's at their office tomorrow, someone's watching now, take Ken's contact info. I wanna just make sure we get this out properly. We have a text code for you. Text CMET to 55444, text CMET. But Ken, if someone has this happen tomorrow, someone's watching now saying, I need to call Ken, because just call Ken and you will help manage and guide through the next step of compliance. How can they reach out to you to do that?
We will set them up with a 2-year program that includes everything. I will say, just if I can real quick, I don't want everybody to think it's only going to be COVID, but we are still seeing needle sticks. We're seeing dental instruments people stuck with. We see the everyday exposures that also have to be recorded.
For sure.
If we're dealing with any type of, it's rare, but if there was an amputation, God forbid, or a loss of an eye, someone's not wearing eyewear and they spill a hazardous material in their eye, well, if they become blind, you now have to call OSHA. You now have to report that.
It's also this, Ken, there's always a good reason to make a good decision. So people are learning Zoom and this stuff because of the pandemic. They might have thought, I never need to do that. Now they want to talk to their grandkids. I just had a question on the Nacho group. Do I need someone in my office to be someone that I dedicate to OSHA? And the answer is yes. It could be you, but if it's not going to be you, so this is a perfect time to use COVID as kind of the lead challenge, but also get the other things in order. I think that's awesome, Ken. Share with us, what are you raffling off for us here today?
We're offering a free online OSHA bloodborne pathogens course, which is about an hour to an hour and a half. And it's giving out 3 free CE credits, which are accredited by the Academy of General Dentistry. What we will be able to do in that free course is to go over the other areas of OSHA and COVID that many offices have not been too busy and they have not been brought up on the standards. So it's important we get that information out to them. And one quick note, I know I'm running on close to my time, but another filing issue that we have to think about in New Jersey, specifically in New Jersey, if a dentist has a medical emergency and they call 911 and that patient needs to be transported to the hospital, the New Jersey Dental Board mandates that they have to fill out the state board form and notify the board that a patient was transported out of their office. So that's also in this compliance. It's another added piece of paperwork that some dentists don't know, and it's for their protection. So in the event the patient comes back 6 months later and claims they didn't treat them and there's a lawsuit, we've got that documentation. It's all about that protection.
It's critical just as much as getting patients to pay into your office, protect everyone there. What's the best website for people to go to, Ken?
They can go to cmet.biz, cmet.biz.
Okay.
You can also see us on our landing page through Nacho's. And reach me through Instagram or email. They can feel free to give me a call anytime. We're here to answer any questions for them. And we're here. We're here to help them get through this.
Awesome. Thanks, Ken. Critical and topping. Thanks for being a key resource and sponsor. Enjoy the show. Interact in the chat. We'll see you soon. Thanks so much.